In this post, we will provide you with excellent personal statement examples that you can use as templates when writing your own personal statement for your residency application.
Sample 1. The basketball player internal medicine. A coach's instructions, 2-team chants, followed by the blare of a whistle, opened and closed basketball practice every day. With repetition, my teammates and I strove for perfection to build a skill set that could be recalled when it mattered most. To love the sport of basketball is to love the grind. During my internal medicine rotation, I witnessed similar devotion by attending physicians and residents. Determination to master the foundation of medicine while engaging in a cohesive multidisciplinary team is what resonated deeply with me and greatly influenced my choice to become an internist. Passionate desire to become a physician first stemmed from when my grandfather was diagnosed with atrial fibrillation and later on heart failure. Initially perplexed by the complexity of his diagnosis, I spent hours researching congestive heart failure, determined to find ways to increase his time with us. Being my grandfather's primary caretaker towards the end of his life instilled the notion of service and fueled my passion for helping others through this career path in medicine. My third-year internal medicine rotation. One of my first patients was a 65-year-old female who was diagnosed with pancreatic cancer and began crying as my attending delivered her prognosis. I talked to her every day, trying to make her feel better. While nothing could completely change her effect, she seemed to appreciate my company. As I reflected on her case, I realized how much I enjoyed getting to know my patients and connecting with them personally, in addition to understanding the complex pathology that plagued them. Several similar experiences on my internal medicine rotation drew me to this specialty, which offers a holistic approach and appeals to my innate desire to understand how things work. Internal medicine requires one to understand the interactions between the different systems to diagnose and treat a patient effectively. Additionally, I enjoy the acutely evolving nature of this field and the endless fellowship opportunities available upon completion of my residency training. Passion for internal medicine led me to start the internal medicine interest group at our school. Listening to the experiences of different internists further solidified my resolve. Seeing the inspiration within the eyes of the younger medical students as our guests talked about this specialty. Models and generational teaching. This was a source of inspiration for me to pursue a career that not only allows me to take excellent care of my patients, but also teach the next generation of doctors on how to do the same. Being the president of this interest group and the point guard for Duke University's basketball team, I gained invaluable insight as to how my past experiences shaped my ability to do better in the future, so that my team could achieve lofty goals. This awareness will prove to be paramount in the hospital when serving as an internal medicine physician. I enter my 4th year of medical school. I realize how similar medicine and basketball are. The teamwork, which unifies everyone towards a similar goal, the perseverance and long hours required to master the profession. The confidence and trust you build between the team and the people relying on its performance are critical to medicine and sport alike. Just as I was a trusted member of my basketball team, who always put the team's interest above mine to ensure our success. I am determined to serve as an integral part of the medical team and will do my best towards becoming an excellent clinician while training at your residency program.
Sample though the farmer, internal medicine ICU. Growing up, my father's dream for my future was that I would someday take over from him in running the family farm. My childhood was a continuous balancing act between completing homework, executing my farm duties, and being a good son to my parents. Years of navigating these competing responsibilities had made me fairly adept at multitasking, and in the back of my mind, I still harbored the fantasy that I could both fulfill my obligations to the farm while also entertaining my growing passion for medicine. However, this naive but well-intentioned vision for my future came crashing down when I was admitted to the hospital for meningitis. Spending days on end in the largest hospital in our city, I witnessed firsthand the impact of exceptional and compassionate patient care. I was impressed by the vast scientific knowledge and skillful manner in which my physician communicated my diagnosis and treatment plan with me. I knew then that I could never work on the family farm and that my true life's calling was to become a physician. For the next 2 years, I worked as a waiter to be able to afford my dream of attending medical school. Every day after a long shift at work, I would return home and study for the admissions exam until I fell asleep. After a grueling 2 years, I gained admission to medical school, thrilled to finally be studying the subject to which I had chosen to dedicate my life. I quickly developed a passion for internal medicine as I began my clinical rotations, and in particular, the high-acuity patients I encountered in the intensive care unit. I was amazed by the medical complexity of each patient and the breadth of knowledge that critical care physicians must have in order to rapidly diagnose and treat patients, many of whom were hanging on to life by a thread. What I most enjoyed about my time rotating in the ICU was that almost every single patient was a medical puzzle, and that it took the concerted and deep collaboration of a whole team of healthcare providers to come to a suitable consensus on patient management. It was particularly awe-inspiring to see patients on the brink of death fully recover after spending a few days in the ICU. I quickly realized that I had found my intellectual and spiritual home, and that I would like nothing more than to dedicate my life to the care of the sickest patients in the hospital. When I expressed my interest in pursuing internal medicine residency followed by a critical care fellowship to my mentor, she immediately recommended pursuing my dream through training in the US given the comparatively better access to cutting-edge technology, clinical experts, and seemingly limitless research opportunities. However, the financial burden was a huge barrier for me. I tackled this obstacle in the only way I had ever known how, by working in the evenings after school and on days off to save up enough money to come to the US. But even that was not enough to reach my goals, so I took on a job as a general practitioner in India for 2 years to be able to afford the plane tickets and the battery of exams needed for entry into US residency programs. This experience helped to hone my clinical skills and bedside manner and will serve me well during my residency training. Additionally, since coming to the US, I have become more involved in clinical research, working alongside critical care physicians at the Mayo Clinic on a number of projects and learning more about the intricacies of the US healthcare system. Having spent 2 years in the US, I am ready to embark on the next step in my academic journey and look for a program with comprehensive internal medicine training and robust research infrastructure to expand my growing passion for clinical research. I aspire to be a clinician scientist who takes insights from my interactions with patients in the ICU to further the field both from a treatment perspective and from the perspective of improving health care equity and access. My journey has been arduous, circuitous, and marked by many obstacles along the way. But I know of no other pathway as intellectually stimulating or personally rewarding as medicine. My father has since come to terms with his initial disappointment that I would not be taking up his mantle to work on the family farm. But he has expressed newfound pride in my goal to pursue medicine and to provide excellent care for patients and their families the way that the doctors that treated my meningitis did for me all those years ago.
Sample 3. Schizophrenia, Psychiatry. I hear voices. These 3 words summarized my grandmother's lifelong suffering. I grew up in an Indian family, accustomed to the tales of old people hearing voices, seeing strange things, and wandering away for months. All this was very commonplace and rarely attended to. In a country plagued with limited access to education and healthcare literacy, mental health disorders were considered a myth. The social stigma precluded discussion of symptoms and provider visits. It was only during my medical schooling that I understood such symptoms to be part of mental illness that affects patients and causes intense distress. As my curiosity was aroused, I found psychiatry to be my true calling. The opportunity to complete 4 months of psychiatry rotations during my final year of medical school allowed me to witness and treat psychiatric diseases that I had only known previously as vague symptoms. I remember taking care of identical twins afflicted with schizoaffective disorder stemming from years of extensive emotional and physical abuse by their family. Years of lack of care and social abandonment had resulted in shared hallucinations and delusions, with multiple suicidal attempts. Effectively gaining their trust by validating their concerns enabled me to unveil their self-injurious behavior and suicidality, prompting appropriate management. On subsequent visits, both patients had significant improvement in their symptoms with a more positive outlook and adherence to medications and psychotherapy. Such experiences and many others that followed provided me with an in-depth insight into the contributing factors to mental health disorders and the effectiveness of prompt and adequate treatment in optimal patient recovery. Since relocating to the United States for a master's program in clinical psychology at the University of San Diego, California, I have gained clinical and research acumen that has further reinforced my passion for psychiatry. My role as a crisis counselor for the past 2 years with Cal Hope, California, has provided me with clinical versatility and a profound understanding of patients' ongoing conflicts. Interacting with hundreds of patients and communities with depression, anxiety, and substance use disorder has helped me hone my skills as a listener to actively pick up subtle cues and offer a tailored approach to care. Nothing has been more gratifying than witnessing patient improvement with the right treatment. Currently, I spearhead the research on the psychological effects of drug misuse and addiction in underserved populations along with different strategies to facilitate early diagnosis and intervention. I have learned the skills required to formulate a research question and design a study from an idea to publication and seek to utilize this knowledge to positively impact patient care across the globe. I am passionate about research and working with communities combating drug addiction and mental health stigmatization. Therefore, I seek a residency program that will equip me with the skills to become an excellent psychiatrist and researcher so that I can build therapeutic alliances with diverse patient groups and backgrounds. My clinical experiences have illuminated that the most admirable physicians are those who cater to the medical and psychological needs of patients from different socioeconomic backgrounds. While my grandmother's tales of hallucinations served as the fuel that ignited my interest in psychiatry, every experience I went through during my medical journey confirmed that psychiatry is my natural calling. I stand now as an aspirant for this field seeking the requisite training that will enable me to be a beacon of support for communities with mental health disorders and break the barriers of stigmatization and social injustice. Sample 4, the Caribbean School OBGYN. Time to close, said the scrub nurse as she placed the needle driver in my hand, just a few hours after a young female patient had presented to the emergency department at the St. Martin Medical Center with vaginal bleeding. Within minutes of her arrival, she was being rolled back to the operating room for a ruptured ectopic pregnancy. As a student rotating on the service, I asked to scrub into the case with the team and was given the opportunity to close at the end of the procedure. That experience was my first exposure to the unique world of obstetrics and gynecology and served as my catalyst for pursuing this specialty. As a second-generation American immigrant, I had watched both my parents train as physicians in their home country and subsequently retrain in America in their respective specialties. Their sacrifice and dedication towards building a foundation and home for me and my siblings inspired my work ethic. Their passion and commitment to their patients drew me to the field of medicine. After persistent efforts, I secured admission into a medical school in the Caribbean. Studying medicine at St. Martin, I knew the challenges that awaited along my career path as a physician seeking to integrate into the American residency system. I pursued each opportunity to serve the medical community of St. Martin while advancing my education as I shadowed OBGYN physicians on Saturday mornings during my free time. I obtained history and examined every patient on the floor prior to them being seen by my attendings. This experience not only improved my clinical knowledge and skills significantly, but also opened my eyes to the diverse needs of the island and its people. Living in St. Martin allowed me to witness the effects of low socioeconomic status, lack of resources, and limited medical literacy on the overall health and well-being of a community. Moving back to the U.S. for my clinical rotations, my passion for women's health continued to fuel my desire to pursue residency training in OBGYN. Whether it was in the delivery room encouraging a first-time mother or in the clinic counseling a patient with bladder incontinence, I was drawn by the breadth of the practice. During my third year of medical school, I assisted a team of OBGYN residents who were comparing surgical outcomes after laparoscopic versus robotic hysterectomy. This experience showed me the impact that researchers can make on patients' lives worldwide and kindled my interest to develop the skill set that propelled an idea to a publication. Presenting our research at the ACOG meeting this past spring allowed me to learn more about the intricacies of OBGYN and engage in meaningful conversations with leaders of the field, although that Saturday morning at the St. Martin Medical Center sparked my interest in this specialty. It was the culmination of my clinical experiences which affirmed it. I look forward to integrating patient care, clinical skill, and technology in surgical management throughout my residency. By training at an academic center, I hope to continue my contributions to this field as a learner, a teacher, and a leader. The same way my parents inspired my passion and dedication to medicine, I hope to inspire future generations during residency and beyond. Sample 5. The Iraqi Female Applicant, Surgery. Females can never be surgeons. These were the words that resonated in my ears every time I expressed my interest in surgery. My medical school tutors, family, friends, all dissuaded me from pursuing this course. In a patriarchal society like the one I grew up in, women were expected to adhere to restrictive cultural norms. Thankfully, I persevered, growing up in war-torn Iraq made for a difficult and unusual childhood. War and fighting were the norm, as were constant displacement and unstable living situations. Due to the unrelenting violence that ravaged the country since before I can remember, the emergency room in my medical school hospital, Al Mosul University Hospital, was constantly flooded with trauma patients. The combination of diverse cases and shortage of clinical staff proved the perfect storm for piquing my surgical interests, as I was afforded the opportunity to perform tasks typically reserved for first and second year residents. Though I quickly rose to the intense demands of working in Al Mosul's ED, my male colleagues would often remind me that surgery was not an appropriate avenue for women, and that I should instead choose an easier specialty that would allow me to focus on raising a family. For me, however, the decision was crystal clear. Surgery was the perfect blend of manual dexterity and methodical decision-making. I was not only fascinated by the diversity of surgical cases, but also by the surgeon's abilities to repair and heal the horrific war injuries. Seeing patients who suffered bomb blasts on the brink of death be stabilized through expert surgical intervention sparked my passion for the incredible restorative power of surgery. The fast pace, required precision, and the exquisite coordination of working as part of a surgical team further cemented my interest. At a local surgical conference, I was fortunate to meet a visiting U.S. surgeon who was in Mosul as part of his mission trip to Iraq. After speaking to him at length about my burgeoning interest in the field, he encouraged me to follow my passion and even helped me secure several rotations in the U.S. It was during these rotations that I received my first exposure to the U.S. healthcare system, from its incredible access to technological advancements unheard of in most Iraqi hospitals to its focus on cultivating a diverse and inclusive workforce. Following my rotations, I spent 2 years as a postdoctoral clinical researcher at Brigham and Women's Hospital, BWH, investigating longitudinal outcomes for trauma patients who sustained debilitating war injuries. My research years were transformational, not only providing me a robust foundation in clinical research, but also giving me a deeper appreciation for the positive impact of holistic care on trauma patients' lives and well-being. As a result of my experiences at BWH, I hope to enroll in a program with equal parts emphasis on surgical and research skills development and that embraces diversity as a core value. Following my residency, I aspire to return to Iraq and continue to treat patients suffering from trauma, conduct research on optimizing outcomes for trauma patients, and educating the next generation of surgeons. As a female growing up in Iraq, I faced many challenges during my quest to secure a residency spot in the U.S. Despite the discouragement of tutors and family members as well as the daunting prospect of starting a long and difficult journey in a new country, I am steadfast in the pursuit of my professional dreams. I have one goal that I will keep fighting for in the years ahead, an unwavering commitment to make a difference in patients' lives and empower women in Iraq and around the world to help me make that difference. My message to those women who, like me, are told by those around them that they can never be surgeons: do not be discouraged. Let their words fuel your strength and fight to make the world a better place for yourself and your patients.